Being at an academic center, and one of the things I love about being at an academic center, and really the reason I'm here, is the opportunity to perform reconstructive surgery. So as part of my fellowship, one of the points of my training was microvascular surgery, which is performing complicated reconstructive techniques and doing the anastomosis of arteries and veins and nerves and blood vessels under microscopes. This is an extensive surgical procedure that takes years to master, and something that I think we are very good at Jefferson. We do more of these surgical procedures than any other medical center in the Philadelphia area. We have 3 microvascular surgeons at Jefferson that are committed to this procedure. We work closely with our head and neck surgeons, and I think offer a great product. This is a wonderful change from my cosmetic practice, in that what we're working for here is not to make someone prettier, but to restore their life. We restore form, we restore function, we allow them to swallow again, we allow them to talk again, we allow them to go out to restaurants without people looking at them again. So this is a very rewarding part of my practice. I do have a laboratory as well. We're committed to research, we're committed to forwarding the reconstruction after head and neck cancer defects. So what is a free flap? You hear this term free flap, and you might be a patient who has been told that you have to have a free flap. Basically what a free flap is, it's taking tissue from one part of the body, changing it around a little bit, and using it for a different purpose in another part of the body. At Jefferson, in our head and neck surgery department, what this most likely is to repair a defect that has been caused by the resection of a cancer. And where we do this is for the tongue, for the jawbone, for the mid-face, for the area around the orbit, for skin cancers that happen on the scalp, where we'll take tissue, and for instance your thigh. So, and this is probably the most common free flap that we perform, is called the anterolateral thigh free flap. And this is taking skin and fat from the leg. We isolate the skin and fat based on a single artery and vein. This artery and vein is anywhere from 2 to 4 millimeters in size. We'll take the skin and the fat, bring it up to the head and neck region, and contour this to replace what has been lost. This can be the esophagus, it can be the pharynx, it can be the tongue. We'll fashion this into a new structure, sew this into place, and then anastomose those little tiny arteries and veins to arteries and veins in your neck. Once those arteries and veins are sewn back together, the blood flow goes again, and the blood really keeps that tissue alive. So that's a microvascular free flap.